host such a wonderful and value-add session. It's a privilege. Thank you, Azil. And thank you, Dr. Sravana Soujanya. And yeah. So before we start, a little about WICCI. WICCI stands for Women Indian Chamber of Commerce and Industries. It's a non-political, non-religious, and a voluntary organization founded by Dr. Harbin Arora Rai. Our council name is Equitable Parenting Council. We are experts from the field of parenting who have come together to volunteer our time, efforts, and skills so that parents get the right knowledge and feel empowered in the parenting journey. So, our council, I'll just quickly take you through a video, quick awareness about our council. Just give me a second. We have taken n number of sessions with multiple experts. The audio play, is it? No?
No.
Oh,
That's
okay.
why I
I'm
messaged.
sorry.
Audio
I'm
is-
sorry. I'm sorry.
So there will be a thing, audio thing over there. While
Yes, yes, yes. Share sound. Yeah, I just missed that.
from there itself, we can continue.
I can. I'll do that.
Going from the start.
So this was all about the number of sessions that we have conducted, and of course under the able guidance of Hazel Marcus, who's the president of WICCI Equitable Parenting. The council is doing fantastic with respect to sessions meant for parents, children, and of course this was again a theme brought in which was for the elderly. Right. So, Aziel, would you like to say a few words?
First of all, a very good afternoon, one and all. It's nice to see so many new names, and I hope to see some faces on. So, if you could switch on your videos, will be nice. In case if it's possible, please do switch on. I think there's always the f- once you see each other, the kind of connection is much more stronger. We are able to, and even from a perspective from an expert, it's always better. We are better able to give you more because we are able to understand if you're understanding the concept, finding it difficult, what is it? And a topic like menopause today, right? Uh, Quite a few things may be new, some things we may know, but it may be conflicting to the ones that we know. And there are quite a few things that Dr. Soujanya will be talking about, discussing, explaining, and considering in today's lifestyle that we are going through and the changes that we are going through in life, menopause has like shifted from 50, earlier it was 50, 55, 60, now it's almost come to 40 and below. And things are changing. Uh, Life cycle is changing. So I hope sessions like this will help you, first of all, to be aware of the changing trends in health and lifestyle and multiple other aspects that we were going to be focusing. And secondly, it hope these sessions help you to live a better life, a healthy life. So with this, and thank you, Sujata, for hosting the session, for agreeing to be a part, to be the host, and Dr. Saujanya for being the expert on the session. Two marvelous council members that I have, without which, and many more who have joined the session, like Shubra. These are council members that help us to support each other, and so that we can bring the best to the society. So now, giving it back to Sujata, please take it forward. Thank you so much. Sujata, you're on mute.
I welcome Dr. Sravana Soujanya this afternoon. Hi, Dr. Sravana Soujanya. Thank you for
No.
accepting the invitation and taking us through one of the very important sessions, very relevant for every woman who is going through the pre or the menopause stage, right? And let me quickly introduce Dr. Sravana Soujanya. Dr. Sravana Soujanya is a highly acclaimed consultant obstetrician and gynecologist with over 14 years of experience in the field. She completed her MBBS from Osmania Medical College and earned a silver medal from NTR University of Health Sciences for her outstanding performance. Dr. Saujana's area of interest are centered on gynecology with a strong emphasis on laparoscopy and hysteroscopy. She is dedicated to providing minimally invasive and holistic healthcare solutions, prioritizing women's well-being through comprehensive care. This includes cervical and breast cancer screening, birth spacing, and family planning, as well as addressing gynecological issues like endometriosis, fibroids, and medical management for abnormal uterine bleeding. While her primary focus is on gynecology, she also ensures comprehensive care for high risk pregnancies, offering a well rounded approach to women's health. And fortunately, both of us are from Hyderabad. So, a quick introduction about myself. I am Sujata, the Vice President of WICCI Equitable Parenting. Dr. Sravana Soujanya is one of the council members, and I hail from Hyderabad. Other than that, I am also a transformation and innovation leadership coach, and I host a podcast which is known as VOB. So, all right. Good afternoon, everyone. I hope all of you have are sitting with your pen and paper and ready with your questions so that Dr. Savana can take you through some of the questions once she shares all the important sharings that she is ready with us. She has brought in for us. All right. So, Dr. Savana, can I ask you what exactly is menopause? If you can brief us, how do a lady comes to know that okay, she's going through this phase?
So, menopause is a condition which is a natural phenomenon which all females has to undergo in their lifetime, just like menarche. So, when a girl child is born, after few years she will be gone through menarche, and she once she reaches, we celebrate it, and in the similar way she will undergo the reproductive age, and later she has to go at a stage menopause. So this is nothing abnormal in it, and we don't consider it as an disease or something. So menopause means there will be no more cycles. Okay, so always the diagnosis we
Yeah.
consider it as retrospective, means so once a female doesn't have a cycle for at least 12 cycles, okay, then we consider it as a menopause. So if some females will be coming and asking after 6 months or 7 months or 3 months also, because of the age, because as menopause varies from wide okay age ranges. In our country it is around 43 to 53, we can say. It depends upon the okay ethnicity, race, everything. Okay, so in our country it is like 43 to 53. So once the woman reaches 43, we can't decide that if she is not getting cycles for 3 to 6 cycles or 7 cycles, she might not be in menopause. Okay, so always we will consider at least 1 year of pain period free only, then we call it as menopause.
Okay,
True,
okay.
she might be reaching in future. Okay, what she is suspecting is might be true, but we should not go into a hurry of menopause. Yes, she is into menopause. We should consider definitely other reasons why is she not getting the cycles, and once
Okay.
all other reasons, okay, whichever causing the loss of cycles has to be ruled out definitely, and then only we consider it as a natural menopause.
Oh, okay. So there would be other reasons as well for or not having the cycles as well. Okay, this
Mm.
was an information for me. I never knew about this. Okay, thank you, Dr. Saujanya. So what is my next question is basically how do you understand what are the symptoms?
Yes. Symptoms of menopause, again very non-specific. Okay,
Mhm.
like they could be physical, emotional, and overall on health also it is going to impact definitely.
Okay,
So physical means like night sweats, or any hot flushes, starting with simple and very common things: vaginal dryness, most commonly irregular, okay, improper cycles, okay, and weight gain, or whatever the things they might be doing, resistant to lose weight, okay, and
okay.
joint pains. These are
Mm.
all some non-specific things, but we will be considering. And emotional, coming to emotions like anxiety, low mood or mood swings, sometimes easy tearfulness, okay, getting hurt easily, means emotionally I am speaking,
Okay,
easy forgetfulness, or
Oh,
confusion,
all right.
uh, okay, mental confusion sometimes, okay, inconclusiveness. Um, Previously, they might be very clear in their thoughts and all. Now it could be
Oh,
little cloudy, mentally cloudy. These are all the things that because of the hormonal issues. Once exactly like prepubertal. So you can see the teenagers having those tantrums and all because of the hormonal issues.
Okay.
The similar way here also many hormonal issues will be women will be facing, which can lead to all these kind of things.
Got it. Got it.
And long term effects like yeah, majorly cardiovascular means heart related, so
Mm-hmm.
blood pressures, and endocrine related like onset of diabetes or something, okay,
Oh,
and joint pains more
oh, okay.
commonly. So
Okay.
these are the long term effects, and one should definitely understand. So once the for a natural menopause I am speaking,
Mm-hmm.
so after menopause also, the main reason is with the hormones as we were discussing. But after once the periods are stopped also, the ovaries will be functioning for at least 3 to 5 to 7. Sometimes if the lifestyle is very good, which we will be discussing later, that
Mm-hmm.
impacts a lot on the hormones. So until 7 years also, women have normal ovaries, okay.
Oh, okay.
So just like after menopause, immediately if we do any scan or something, just for understanding, I am saying we won't do scan for everyone or hormonal test for everyone. If we do scan after menopause, the female might be having normal ovaries, normal uterus, everything normal. Size
Oh,
wise, I am saying. That's the impact I am saying. It takes a lot of duration to shrink of the ovaries or uterus, everything.
oh, okay, okay, okay.
So it will be functioning. All the things will be functioning. Ovaries will be functioning until after menopause also, until certain period of time, and giving us the required hormones for our well-being.
Oh, okay.
So that
So,
is our main funda. We will be focusing to manage the menopause, to
mm-hmm.
keep the hormones for our well-being.
Oh, okay. So, Dr. Sravana, now I am aware that there are heavy periods happening, but yeah, does the symptoms also include there are scanty periods, right?
Yes.
Both are symptoms, is it?
Both are
Or
irregular
oh,
cycles include like there could be frequency of duration might be longer, like
mhm,
once in 2 months, 3 months, or 4 months cycle can come, or
mhm.
sometimes the frequency can become shorter, like once in 15 days, 20 days also the cycle will be happening.
Okay,
And
okay.
sometimes duration of the cycle can become shorter, duration
Oh,
can become longer, and
okay.
the amount of flow like every day they might be changing uh, like 4 to 5 pads, which is normal.
Mm,
They can
mhm.
change up to 6 to 7, or they might be changing 1 to 2 also, or only
Okay.
spotting also. All these we consider it as irregular cycles only. The thing is, as I mentioned you, we should not go carry away like it is a perimenopausal age. What is perimenopausal age means? The age before, as I said you, it is a gradual process. So
Mm-hmm.
as it goes on, it might be turning into menopause. So because of the hormonal fluctuations and all, there could be irregular cycles, but we should not consider it as alone. So definitely we should, okay, rule out all other conditions which cause the same features,
Okay, okay.
and then we can be assured and can assure the patients that nothing abnormal going on. We will
Got
wait
it.
and watch.
Got it, got it. So any kind of irregularities can cause menopause. At the same time, there may be other health conditions which is causing these kind of irregularities, right?
Yes.
All right. That was fantastic. That was really an information for me. All right. Now, Dr. Saujanya, can you just take us through, like, this hormone
therapy, it's so much hyped, right? It is dangerous or you have to take it. Medical terminology, when as a layman I'm speaking, I get scared when I hear, okay, someone is going through hormonal therapy, or my friends, my cousins share about it. But at the same time, there are conditions where they really need it. So can you please take us through that?
Yes. So many consider hormone replacement therapy as a dangerous thing, and many consider it is the one and only treatment for menopause.
Okay.
But it's not so. Okay. Some conditions are there where the woman requires the hormones, which are essential. As I mentioned, if it is causing any symptoms on the cardiovascular systems or joints, even with supplements, they are unable to cope up. Even with many lifestyle changes, they are unable to cope up. We have to give it. And one more thing, if the as I mentioned, the years of menopause. So if one reaches menopause before 40, these days we are seeing that. So at that time, we may advise the female to take the HRT, especially if
Mm-hmm.
it is less than 40. Okay.
Okay.
So depending upon their symptoms. So
Okay.
many times menopausal symptoms can be treated without HRT, and if at
Oh.
all required, because of might be because of her other medical okay, generalized body checkups, they may be
Mm-hmm.
diagnosed with some other conditions
Okay.
who may require, then we need to give it HRT.
Got it. Got
So
it.
it has its own benefits. At the same time, it is not a routine supplement also.
Mm-hmm. So, doctor, there is one question. Is the damage of joint going to remain permanent even after the menopause phase? So, is it, it is going to be a lifelong thing, or there are, instances, there are patients or cases wherein it is a temporary phase while during the menopause period, or how is it?
Joint, you mean bone joints?
Yeah, Swati has asked this question. Will the damage to joint remain permanent even after the menopause phase?
What was the damage to the joint?
Would you like to share?
Yes, ma'am.
Sure.
May I?
Yes, Swati, go ahead.
Yes.
Ma'am, it's shoulder hurts a lot while sleeping, especially the
Mm-hmm.
shoulder joint.
Okay.
Sometimes there is a pain in the knee joint, especially the shoulder up more.
Mm-hmm.
So, is there a damage, or it's just a phase, menopausal phase where it's just hurting? So, wanted to know more about it.
So, what is your age?
Ma'am, I'm 41 right now.
Don't mind, but any diabetes history?
No, I don't have any diabetes history. It just so happened I was getting my periods regular. Last month it skipped, and this month I again got it. So the after the period of 1 month when I got the period, it was too heavy, tiring, and this shoulder pain is since completed my 40 years. It's like a year. It's like I'm getting a shoulder pain there. But
Shoulder pain might not be because of this issue, I feel, and menopause is not in your case, definitely. So, shoulder pain might be because of some other condition we should be ruling out, okay? Because of any exercise or excessive strain or any muscle sprain or any ligament issue, okay? So, we should look into it, definitely.
So I think, yeah, Swati, you're on mute, dear. You're talking. Yeah.
yes, ma'am, sure, I'll show it to an orthopedic, and I'll rule out that.
Uh,
Yeah, absolutely. Absolutely. So, yes. Thank you, Swati. Thank you for your question. All
Thank you.
right. So, Dr. Saujanya, there are a few more questions for you, uh, now, whether this is a myth or this is a truth, I do not know. But life slows down after menopause. There are health challenges. You become a little not so active. Your body gets lethargic, or can you please throw some light on it?
Definitely, but this is another phase, as I have been mentioning. So
Okay.
how we are going to take this and how we are going to manage this phase definitely matters the how our life would be. And we have to take an opportunity to look into our okay lifestyle definitely, and see if and correct them if there are any things need to be corrected. uh, we can definitely overcome all the things, all the things which we were having even before menopause also we might be suffering for some conditions. And if we
Mm-hmm.
consider in another way, now we are not having cycles, so no need of taking any pills, and no need of any tension anxiety. We can attend wherever we want to, and we can plan whatever we want. So it is definitely not like that. We can keep ourselves energetic and high in mood also after menopause. And we should see the positive things in it. Okay, we have more time considerably before than that at that age, so free of responsibilities. Only thing is we have to focus on ourselves and our health and our mental well-being with
Mm.
some changes in our lifestyle.
All right, all right. So, do you mean to say, Dr. Sravana, that this menopause phase is going to be for a period of time and later life becomes a little more normal? And because we have been seeing, right, very elderly ladies, like, in their 80s or even touching 90s, and they're doing yoga, so flexible yoga, all the postures and all that. So, I mean, there is no hard and fast rule that, life stops or slows down from there on, right?
So, because our body takes some time to adjust to anything.
Change.
Similarly, like in pregnancy, we had some issues.
Mm,
Postpartum, we had some issues. In the
mm.
similar way, here also during the menopause, we have some hormonal changes. Because of that, we will have some issues. And if we know how to tackle them, and if we are going to correct them, okay, nicely, then we the period stays for a shorter period only. Or sometimes people never say that before and after I am having the same kind of energy levels or any same moods. Some people will say that if their lifestyle was good prior also, and they are able to continue the same, and they should
Mhm.
understand their body and maintain that yoga and all you are saying. So they should understand up to what flexibility their body is, and if they can continue the same. And not only yoga, they can do walking or stretching exercise, anything whatever they are able to do and their body is coping up with that, they can
Okay.
continue that.
Okay.
And then the period of suffering will be less.
Oh, all right, all right. So, Dr. Shravana, is it okay that these kind of Zumba or these aerobics or these also can be taken?
Yes. So for this, we need to consider one overall health, as I was mentioning, like cardiovascular and joints will be the affecting most after menopause, because the estrogen levels will be markedly low after menopause.
Mm-hmm.
So as the estrogen is less, the body absorption of calcium, vitamin D, and cardioprotective kind of things will be less.
Mm-hmm.
That's the reason one might go into easily fractures. Okay,
Oh,
because
okay.
of bone mineral density will be less
Got it. Huh.
in old age.
Right,
Not
right, right.
only us, even in the males also, the bone mineral density goes okay lower after 70s or so. Okay,
Okay.
and because of there also andropause is there for them like menopause.
Mm-hmm.
So the because of the sex hormones, they have the ability to retain this calcium and all. So
Okay.
we need to consider something like calcium supplements and vitamin D supplements, exposure to sun definitely. Even
Mm-hmm.
only supplements doesn't help, definitely we have to go for the dietary and the natural process. And
Got it.
this they can have high blood pressures after menopause because of this. And cardiovascular risks also will be more. So do aerobics and zumba, these are all considered as severe exercises. Mild,
Right,
moderate, severe
right, right,
exercises
right,
will be there.
right.
So that comes under severe activity form.
Okay.
Usually, we won't encourage severe kind of thing
Got it.
because it affects both the cardio and the joint
Got it.
skeletal
Got it,
system.
Dr. Sravana.
So we have to balance them.
Got it.
So mild to moderate exercises will
All right.
help them,
All right.
and
Very
they can
rigorous.
tolerate well.
Okay. Very rigorous and very hyperactive activities might be should be avoided, right? All
Yes.
right. All right. That's again very insightful. Now, yeah, my next question is like, I think you have already answered about how it impacts on the health,
Overall
the
health,
physical health.
one more thing, sexual health. So
Okay.
people ask me whether one can undergo intercourse after menopause. Is it
Hmm.
safe? Some believe one should not have it, but
Mm-hmm.
nothing like that. It's all depends. It's completely a personal choice. If one feels like and if one is comfortable in it, they can have the
Okay.
intercourse. Okay. And
Okay.
if one is not comfortable, it's okay. Again, it helps in vaginal lubrication. A woman has a vaginal dryness after menopause. If the
Hmm.
woman is actually okay, wants the intercourse and involves in it, okay, voluntarily, then vaginal dryness will be less in them. And
Got it.
so one can have on their wish.
All right. All right. All right. Oh. All right, so Dr. Sravana, now how do we manage with it? It is very very. I don't know, like when the onset of puberty and like the menstrual cycle and all that, how it is very chaotic. Same way again the menopause because I have gone through very heavy bleeding and stuff, so that was extremely chaotic for me personally. Now, how do we manage those kind of things? How do we manage with it there, because it is not only the physical thing, it's a lot of emotions, it's a lot of traumatic also, I can say, right?
Yes.
Yes, please take us
So
through.
yes, so this all comes under lifestyle changes. Not only for menopause, for every individual, there should be lifestyle, quality lifestyle, and they have to check for that from childhood to until we go off this earth. We have to follow some lifestyle policies like that. So in that, diet plays a major role. So, as I mentioned, calcium deficiency will be there. So, we have to take calcium rich diet. And perimenopausal women might be having their regular cycles, or as I mentioned, irregular cycles. Many times they might be having heavy cycles, as you were saying. So, iron rich diet is also very important. And vitamin D, exposure to sunlight and all. And if at all required, okay, some people have less absorption capability. So depending upon the body tendency, even though if they might be taking adequately, and because of the hormonal issues and all, might be absorptions are less at that time, they might be okay, because of that deficiency could happen. So one can consider supplements after 40s or so: calcium, vitamin D, iron, and B complex.
Got it.
These kind of supplements, and always be hydrated. Hydration is very very important, and we know 70% of our body is made up of water, and we have to replenish it definitely.
Okay,
Okay,
okay.
majority of the problems will be solved with good hydration and diet,
All
majority.
right, all right. What about sleep,
And
Dr. Sravana?
exercise.
How does sleep
Yes,
play a role?
I'm coming to that. Next part with the physical activity. So one
Hmm.
should consider at least walking, whatever may be the age, however the mobility, okay, they can do whatever however mobile they are, they have to be mobile. Okay,
Okay,
doing their works on their own, whatever way possible, even at 80s or so. Okay, but one should be very much mobile and active. Okay, and if one can do weight bearing exercises, not like aerobics or zumba definitely, but
okay,
stretching exercises and using our own body weights,
okay.
mild yoga poses and all. Take your own time, understand your body and how it feels comfortable. In those poses, you can maintain your body and see the differences. Definitely, one cannot appreciate differences in a period of weeks or months. It takes some time. Okay, so be gradual on your body, and consistency is the key factor. We have to maintain the same, yeah, whether it is diet or the physical activity, we
Okay.
should be maintaining that. So it helps not only to our menopause, other conditions, okay, other general conditions like high blood pressures or sugars, heart issues, any other issues also could be addressed with this kind of thing. And as you were mentioning, sleep plays a major role again. And 6 to 8 hours, definitely quality sleep has to be maintained, that to night time. Okay.
Mm.
So circadian rhythm also has to be maintained. If we are going
Okay.
to sleep in the morning, 10 hours also might not be effective
Helpful.
as the night sleep.
Mm.
We have to maintain that 6 hours sleep at least during the night time.
Got
Peak
it.
hours between 10 to 4 is the ideal. So
Okay.
at least 12 to 6 or so also fine. We have to maintain that circadian rhythm also.
Got it. Got
And
it.
also stress management. So
Mm.
that is also whatever things we are able to do, we are doing it. So we should be first saying ourselves that we are doing our part good and don't take too much of responsibilities. Be okay, little selfish here, and keep yourself ahead and maintain your mental and physical health, and keep away from all kind of uh, uh, yeah,
Stressful
and
things, right?
keep yourself peace.
All right, all right, all right. So, any recommendations, Dr. Stravana, for any tips that you can suggest for managing the stress?
Meditation has a very nice role in it. So try to meditate even 10 minutes also fine, especially during your first hours when you wake up and the
Mm.
last hours. It has to be yours definitely, and you
Mm.
have to introspect yourself. Introspection also plays a major role.
Right.
You are the judge for your activities or thoughts or words or anything. If you feel you have done something, you can express it. If you have not done, no need to explain it to anyone. So first few minutes of your day and last few minutes of your day has to be yours. Anything apart from meditation, each one has their own kind of thing, prayers, chanting,
True.
mantras, slow,
True.
anything will work.
Got it, Dr. Sravana. So here this also brings to me that me time is extremely important with you yourself. At the same time, putting your oxygen mask is very important before you take care of others, isn't it? All right. So lovely, amazing, Dr. Sravana. Now, Dr. Sravana, one more question is when to see a doctor? Because when this onset of menopause starts, sometimes it is normal only, sometimes there is no periods, okay, 2 months, 3 months, it's not there. All of a sudden it appears. Sometimes it is scanty, sometimes it is very heavy. So what are the symptoms? What could be the indicative symptoms that, we should, see the doctor?
So as the menopausal symptoms are very non-specific as well mentioning.
Okay.
So irregular cycles means okay, for 1 to 3 cycles we can consider it okay. If it is
Mm-hmm.
happening more frequently,
Hmm.
definitely take a medical advice to check
Okay.
whether some other things are going on, okay, apart from this.
Got
Okay.
it.
And especially after menopause, there
Hmm.
should not be bleeding at all. Okay.
Okay.
Some people come in later stages and all and say, I thought it was fine to have one episode of bleeding after menopause. That happened 2 years back or
Okay.
some. So
Okay.
never neglect post-menopausal bleeding. So once
Oh,
you are diagnosed as menopause, means you did not get cycles for 12 months and
mm-hmm.
free of cycles, and later if you are going to experience either spotting also, okay.
Okay.
Okay, it is always to rule out than to be quiet, because
Got it.
many times early stages, our especially the gynec cancers and all this, don't be bombarded with my words, but I thought this is the platform you will be
Absolutely.
getting the right knowledge from. So I am
Absolutely.
saying, so many times breast cancer, you can consider either breast cancer or the uterine or ovarian, whatever. So if we can find them at very early stages, you can have the normal life, okay, near normal life, we say that. So that's the reason, never miss the symptom of postmenopausal bleeding or spotting.
Okay.
And postcoital bleeding. What is postcoital bleeding means? After the intercourse, one should not experience any type of bleeding.
Bleeding. Oh, okay.
Okay.
Okay, got it.
So these two signs, take the medical help first.
Got it. Got it.
If it could be normal for n number of times, but take that. Okay.
Got it. Got
So
it.
sometimes postcoital bleed might be because of this vaginal dryness also. With that, you might be having the painful intercourse and all.
Got it.
So it could be a normal feature only, but you will get a treatment for it. Okay. We can treat the vaginal dryness.
Okay.
So with that also, you will be able to have a quality life.
Lovely.
So vaginal, I mean postcoital bleeding and dyspareunia means painful intercourse. These
Got
things,
it.
and uh, so, and we were talking about emotional symptoms, if don't consider it is normal, okay, this will happen, but they also have treatments, from behavioral therapies to sometimes medication might be prescribed, but you will have the difference, you can maintain the quality of life. So if you are if the quality of life is disturbing with your anxiety, might be because of anxiety or depression, low mood swings, anything, if it is more than the acceptable things, not only for you, for the people around you, if the
Okay.
people around you are saying it is going beyond their, okay, tolerance, then we need to consider it. Okay. And every time, every person might not be taking the things, okay, because we are in menopause, other people can't take it every time. If they are saying that it is out of their tolerance levels or something, then we need to consider medical help again
Got it.
regarding this.
Got it. So, Dr. Sravana, now there are a couple of questions. Okay, but before I also wanted to ask one question. Like, there are people who also, like, their periods are going on even when they are 60. A couple of instances I have come across. Is that normal, or like, is that abnormal? What is it?
This is one more interesting question. So people are having these days after for 53, 55, or as you were saying, up to 60 also, but definitely it should not be. We need to
Okay.
evaluate it. Okay.
Okay.
There the chances of progressing into some other conditions which we don't want to is
Okay.
more. So
Okay.
definitely we need to do some basic, okay, hysteroscopic
Tests
guided
and all
biopsy or
right.
thing, and we should consider whether it is okay, normal or something. If they are very particular, then we will be offering some other situations like Marina or something. Or if they don't want, means we will be proceeding with hysterectomy. And one more case where we need to consider is if they are getting menopause, not having cycles for more than a year before 40.
Before 40. Acha.
Before 40.
Okay. Okay. Okay.
So sometimes we see cases getting we say it as a premature menopause. Premature ovarian failure, we say, not to understanding, I said menopause, premature ovarian failure, we say.
Okay.
So these conditions has those people require HRT, as I was mentioning, because the thing is, when we are born only, we will be having some quantity of eggs in our ovary, and that will be released every month. And once the
Okay.
eggs are done, we reach into menopause. That's the reason it will vary with every woman. You will
Individual,
be having
acha.
one thing, and I will be having another menopausal age. So if the ovary is get rid of all the eggs before, only before
Hmm.
40, like 35, 32 or so,
Hmm.
then the chances of all the long term health effects what it is going to give will be more. That's the
Okay.
reason we will be starting the HRT prior.
Got it. Got it. Got it. Got it, Dr. Shravana. So there are a few questions, Dr. Shravana. Now, we do consult, when you consult a doctor, you are advised for certain supplements. Now, should one consult before taking the supplements, and why is it important? And also, I would like to add, to what duration? Like, there are these vitamins supplements, or iron supplements, or, B12. These supplements are given. To what extent, or how long one can take, or should it be taken in intervals? What is it? Can you please recommend us
So below 40, I usually don't recommend, not only me,
supplements?
anyone doesn't recommend supplements except for the pregnancy and postpartum period while
Mhm.
lactation and all. So
Mhm.
after 40s, as I was mentioning, if even with the dietary additions also, if the person is unable to maintain the levels, yearly
Mhm.
checkups are mandatory, I would say, for all the females after the
Mhm.
age of 40. So in that we will come to know if there is any deficiencies like iron deficiency or anemia and all. We can pick it up, and B12, D vitamin, calcium. These are all the tests routinely done in the
Got
yearly
it.
checkups.
Mhm.
So if we feel it can be managed with diet alone, we usually suggest to increase the dietary portions of them. Even after that, if they are having the same levels, then we will consider the supplements.
Supplements. All
And
right.
if we are taking supplements also, it has to be taken for a period of 3 months, I would say, either calcium or iron, vitamin D. After
Mhm.
that, definitely we need to stop and see our body response to the
Okay.
dietary thing. While
Okay.
taking supplements, one should not consider it will take its own job.
Time.
I should
Mhm.
not take the dietary thing. They have to continue the dietary part also and take the
Got it.
supplements as an additional thing. And we should allow a gap, and so that our body doesn't acclimatize only to the supplements, but it should be taking the our dietary absorption also should be promoted.
Got it. Got it. Got it, Dr. Sravana. Now, also, Sangeeta Kanwar has asked this question: why on third and fourth day heavy bleeding starts? What is the reason for that? She has this challenge. Yeah.
So usually first at the end of the first day or second day, the cycle will be at its peak for next 2 days or so, it depending upon your cycle.
Mhm.
Like 4 to 5 days cycle means it will be the usual pattern. On the fifth day again it will come down. Okay, if you are
Mhm.
having first 3 days of only spotting, and then you are going to have this proper cycle in the from the fourth day or fifth day means spotting means there is some hormonal imbalances. Nowadays, PCOS is the main reason of hormonal, one type of hormonal imbalance. So we
Mhm.
should be considering that lifestyle changes plays the major role in PCOS. More than any medication or anything, if we can change our lifestyle, then gradually it can be corrected. So
Mm.
start this and check yourself for at least an year, Amma. Then you might see the decrease. So you will be getting normal flow on the third day initially. Then it comes to second day like that.
Got it.
Okay.
Got it. So your question is answered, Sangeeta. Do you have any other question? Thank you. All right. Now, yeah, Gayatri has mentioned here. Of course, Gayatri is only 33 years, but she has pain during periods. Once she takes some painkillers, it gives her some relief. Now she's asking, please let me know, do I need to consult gynecologist and what is the reason for my periods pain?
So how is your pain? So pain.
Gayatri, I would
Having
like you to unmute and then answer. I think Dr. Sravana is asking you some questions.
how what
Sure,
is the
ma'am.
severity of the pain? Can you say, Gayatri?
Uh, it is very high, ma'am, during the
Means
period.
you are not able to do your day-to-day life activities?
Yes, ma'am. After taking painkillers, I'm able to do little work only. Can't
Okay.
able to even stand also.
Okay. Is there any vomitings or sweating, any loose motions along with the pain?
No, ma'am. Sometimes I have vomitings only, ma'am.
So definitely consider a gynec help, Amma. Don't
Okay.
worry. We will be checking for any endometriosis or any other issues going on. Okay. So some kind of pain, discomfort will be there during the cycles. Okay, which is considered normal only. And if it is
Okay.
not affecting the quality of life, then
Mhm.
it's okay. If it is
Okay.
disturbing your day-to-day life, then definitely you should consider a gynec help and have a scan done, and we can rule
Okay.
out some things. Don't
Okay.
worry.
Sure. Thank you so much, ma'am.
All right, Dr. Shravana, there is one question from Runa. Hi, Runa. So, Runa says, Ma'am, I have had my menopause gradually, and while I still get the emotional outburst and mood swings and joint pains, fatigue, and related symptoms that you mentioned just now, like, I think while we were discussing, she has posted this question. But now, what is bothering me the most is losing hair in an alarming rate after menopause. And I have melasma on my face. This is very disturbing. Do you think I need HRT? I am 54. I had my menopause at around 52.
So from 52 to 54 means usually it was a natural menopause, right? No,
Yes,
not
ma'am. Yes.
surgical, right? So usually, okay, if are you diabetic or hypertensive,
No,
any
ma'am.
other thyroid issues?
No, ma'am. Thyroid and diabetes, I do not have, not even high heart-related issues, but I do have osteopenia, which is particularly genetical, the doctor said, because my mom had osteoarthritis. She just passed away last year, and my dad has rheumatoid arthritis. Though my weight is absolutely within control, I'm 54 kgs and 5 feet 3 inches tall, and absolutely active in my household works, regular works, and I go for walk, I do meditation, I do yoga. So the flexibility part and all these things are absolutely fine. I mean, all are balanced, I can say, and balanced diet. No lifestyle disorder like smoking, drinking, nothing. But I do have sleep disorder, so I am on some medication for that. Lately, since my mom passed away, it actually aggravated, and this losing of hair also has started a year back. It is now so much that I had to question that, is it something abnormal? I have no other concerns like no spotting, no bleeding, no abdominal pain, nothing which is abnormal. But the melasma started like small brownish spots on the cheekbone, and it has suddenly increased. And losing my hair also has become a very emotionally disturbed situation.
Okay. So you said rheumatoid arthritis with your father, but you are not having any arthritis issues, especially rheumatoid,
I
right?
have joint pains, ma'am, but I have not been diagnosed with osteoarthritis yet. It is called osteopenia, which is probably one phase before the osteoarthritis. So I am
Was
taking,
the rheumatoid factor positive in your case at any time?
no, ma'am.
No. So osteopenia, the moment the doctor said, I am a osteopenia patient, which means the bones are getting
At what
degenerated.
age you were diagnosed with it?
2 years, 1.5 years back, kind.
Oh, okay, okay. It could be age related only,
Yes,
might
it
be.
could be age
Okay.
related and it is somewhat genetical. So I am taking supplements and more calcium and protein rich diet, all of these things that you already have mentioned. The diet
Okay.
plays a very vital role. But yes, emotional health is something I can't control all the time. And if the days which are depressing or emotionally challenging, I don't get sleep and I have a tendency to take more sugar those days. But luckily, touchwood, I do not have sugar. I check every month because my mom had sugar. So I was told that I should keep this checking
You
all
will
the
be
time
fine.
so that genetically I don't carry it and don't.
Yeah, Arun, the thing is, one is you have the tendency of low bone density. So continue the same thing and take supplements also. You might be requiring phosphorus also. Consider ortho opinion definitely before taking that. Okay, because even phosphorus is also very much important for the bone mineral density along with calcium and vitamin D, and have that checking done. And I feel you are having the skin sensitivity. That's the reason you are getting, because of this hormonal changes happens, it is more obvious now to get the melasma and all. It is there. You can consider dermatology opinion definitely and have the thing for both. And sometimes the medications what you were taking for the sleep sedatives you were mentioning, so it could be a reason. So check with your the with psychiatrist or psychologist who has given the medication. You can consider the opinion, and if you can change if it is the reason, or else take supplements for the strength. That will be sufficient.
So I guess, Runa, your question is answered. All right. Now I think Dr. Sravana can take a couple of more questions if anyone has. No more questions. I guess, Dr. Sravana, you have given even enough insights for, women as a key takeaway. Yes, Lekha, I see you unmute yourself. Do you have a question?
No, not personally. I'm 70. It's not personally for me.
Okay.
But I come across these youngsters who keep saying, especially my daughter had it, severe pain during periods, and once she had fainted. So those days, this was quite some time ago. So even
Oh.
nowadays also I see Dr. Sravana, many youngsters having this severe pain during the menopause days, 3, 4 days, like pain and all that. I'm just asking like a general question. Why is it? Is it genetic, or how come these kids have so much of pain while the periods are there?
Okay.
Just,
So
just for information, I want.
yes,
Guidance.
it requires the limelight definitely, because nowadays the endometriosis is on very, okay, it is on rise, we say. So 1 in 10, not 10, 4 in 10, 4 in 10 people are having this endometriosis, we can say.
Wow.
What is endometriosis means? The uterus lining is called endometrium, and the endometrium is present other than this place, any other place, especially in the ovaries or surrounding the uterus. All these places, it is called endometriosis. Okay, that is very okay annoying, which is like usually with the hormonal influence and all, the endometrium gets okay thickened, and if there is no pregnancy, it will come out as the blood, okay, menstrual blood. But if it is inside the ovary, okay, or else outside the uterus somewhere. Then with this hormonal influence, even that tissue, okay, swells up, okay, grows in size, and that's the reason it causes severe pain, okay. And if it is inside the muscle of the uterus, then we call it as adenomyosis. Because of this adenomyosis and endometriosis, nowadays people are experiencing severe pain. Fortunately, we are able to diagnose it, okay, if it is more than 1 centimeter or at least 0.5 centimeter. If it is less than 0.5 centimeter also, symptoms will be there, but we are unable to pick it up on routine scans or something, okay. So that's the reason many times the vaginal scan will be normal, MRIs will be normal, but still they have very severe pain. And where the exactly the endometriotic deposit is, if it is nearer to the nerve, we say, then the pain will be very excruciating. If it is somewhere away, and even if it is 1 centimeter 2 centimeters also, the patient will be having very less symptoms. But sometimes normal scan, but the female will be saying severe excruciating pain, because it might be somewhere where the nerve is there, which we are unable to pick it up on the routine investigations. So this endometriosis has to be because of multiple other condition, other chemicals or pesticides, whatever we can say, plastics. These are all the things which are making this rising trend.
Okay, so then if I come across one of all these youngsters in the family, so what should I tell them? Like, like I met you all and we had this webinar and doctor, anything, do they need to see a gynac or do they
As
need
I was
to?
mentioning, if it is disturbing their quality of life, definitely they have to, and they should be under follow up. Okay, every 6 months or 1 year scans has to be done to see if there is any development of the endometriosis, and if it very early stage, then we can have the marina inserted, or pills can be taken. Okay, only progesterones can be given, or injections, depot injections are available, depending upon the goals what they want. Okay, if they are planning for pregnancy, we will be having some other protocols. Based upon that, we will do. If it is
These are
not
all
affecting their
youngsters.
quality of life, and if it is there, if still we suspect endometriosis, lifestyle changes again. So we have to decrease all this processed and packed food, and try to, okay, take less flavored artificial sweeteners. All these things has to be cut down. Go back to like how you were, okay, having your
Yes.
quality life at your time. Food, take that diet part or activity part, whatever, homemade foods, all these things, okay. Go back to our ancestors, I say.
Yeah,
So
I'll tell
that
them.
thing will help a lot.
Okay, thank you so much. That was very kind of you. Thank you so much. Very informative.
Thank you, Lekha. Thank you for the question, and I really love the concern that you have for the ones who are in the phase, and like you are willing to help them.
Yeah, you feel very sad when they say, "Oh my God, I
True,
can't move, I can't."
true.
They're reeling with pain. My
Yeah.
daughter's time, we didn't know much. This is about, say, 30, 35 years ago. Like one day I was at work and my nephew calls up, Ayo, Bhavisha, Ekandi, she fainted. She's fainted, fallen off the cot. I had to rush from office. So bad was her pain. But those days we just used to give hot water bag and massage.
True, true,
Yeah, thing.
true. Absolutely.
But now since there's so much available, so I thought it's a good opportunity to find out from
True,
doctor.
very true, very true.
Thank
Thank you, Lekha. Okay, Dr. Sravana, there are two more questions. Ma'am, I was told that the Aruna again has posted this question. Ma'am, I was told that the hormones will subside slowly and the hyperpigmentation as well as the thinning of hair will also go down, but it hasn't. So, do you think hormones actually subside with time?
Yes. So, as I was mentioning, uterus, ovaries, all shrink in size. Okay, so before puberty, how the infantile uterus, infantile ovaries will be there without much action, but still they are female girls. In the similar way, even we after menopause, the uterus size, ovary size will shrink and produce very minimal hormones,
Got it.
which are necessary for our well-being. So at a point of time, ovary is completely going to atrophy, and other parts like our body fat, and these also can produce little quantity of estrogen, but definitely fat is good. So don't think if we become fat, menopausal symptoms will be less. But from body fat and visceral fats, estrogen will be produced, and that is sufficient for our well-being in our later stages. And
Got
hair thinning will be there at our as we age, definitely hair gets thinned.
Okay, all right, all right. Thank you, Dr. Sravana. One last question, Swati Dubey's question, ma'am. Some symptoms we too face, like joint pains, painful intercourse, emotional outburst, and she's 41. Just last month, she has skipped her periods. Is it not? If it is not menopause, then what phase I may be in? Is what is her question?
So, painful intercourse is not the feature of menopausal. Okay, painful intercourse can be because of low lubrication. So, low lubrication could be because of either infections or hygiene problem or any pH variations. So, one should be cleaning their private parts only with water, not even soap. Okay, only with water. I'm repeating. So don't use any kind of doshes or any other thing. And because those are all irritants that will kill other normal bacteria will be there in our vagina
Okay,
or
okay.
our nose or mouth. Anywhere we will be having some good bacteria, we say that good bacteria should not be disturbed. When it is disturbed, the pH varies, and then there could be irritation or itching or painful intercourse, or if it is severe, infections also. And one has to rule out urinary infections also.
Got it. Got it. Got it, Dr. Savana. Thank you so much for
Okay,
your
I got
very
one more.
insightful.
When you said about this, I just got one. Can I just ask Dr. Sravana something? We are
Yeah,
talking about
last question.
when you're
Yes,
talking
yes.
about the vagina. Doctor, can I ask you this?
Yes,
Because
yes.
sometimes, even at my age, I think so, it could be dryness of the vagina, because sometimes the vagina, the like sometimes very itchy. So I generally, because from childhood, we've been told to apply little bit of coconut oil, and sort of thing it. So is that okay? But I've been doing it.
Source of the coconut oil and its sterility is also important. Okay,
Yeah,
so if you are confident about the sterility, means
yes,
it is not mixed with any other things, then
nothing.
only superficial, never into the vagina.
No,
Okay,
no,
only
just superficial.
superficial. Huh?
Just not internal, just
Yes.
externally, just applying it, because itching is not internal. Itching is
Oh.
just outside on the superficial area.
Okay, it could be because of dermal means dryness. Okay,
Dryness.
even the normal skin, okay, on the face or
Yes.
hands also, as we age, dryness will be more because of the less secretion of the oil glands. Okay,
Yes.
so because of that, it could be nice emollient also works well, and probiotics. Okay, so probiotics should be included in your diet. Okay.
I do have probiotics. I have curd
Mm.
every day.
So probiotics
I have
also keeps
buttermilk.
natural lubrication.
Yeah. I just externally apply a little bit of, I apply on my body after a shower, pure coconut oil, virgin coconut oil. And then that hand, I just apply it down there, the external part of the vagina, when it itches. So just was asking you. Thank you so much. Take care.
Thank you so much, Dr. Sravana. It was such a wonderful and insightful session. Though I know I have undergone my own hysterectomy, so but then still it was very insightful. And I having a lot of cousins and sisters. I think I'm definitely having a huge many takeaways from this session. Thanks a lot. Thank you, Lakshmi. Thank you, Aziel. Aziel, would you like to speak a few words?
Uh, I didn't quite expect that almost 22 participants will come in at because this is the first time that we conducted it around 3 o'clock early afternoon. However, it's nice to see the concerns that came in, the struggles about oneself, about our maybe our children, grandchildren. And it's nice also to see that there are men who have joined the session who are here mainly for their daughters, for their wife, or for the people that they are concerned about. So, this is what we are looking at, where we come together not only to support ourselves, but also to support our family members and the people that we love, truly cherish. So thank you so much, Dr. Sravana Soujanya. I think in such a simple layperson's language, you have cleared so many doubts, so many concerns, and explained it so well. Thank you so much for your time, for your expertise, and God bless you. And hope your venture grows well, and hope you keep impacting many more lives. Thank you, Sujata, for hosting so well and like taking every question into consideration and putting it forth so beautifully. Thank you so much. Just to
Thank
share, there are two sessions that are upcoming. One is on waste management.
Okay.
On Sunday, we will be sharing the details shortly. I hope everyone is in the WhatsApp group.
Sunday.
Yeah, so we'll share the within a day or 2 days time, we will share the flyer for that. And the second is on dementia and Alzheimer's. This
Yeah, that. See, the thing is, like I had mentioned last Sunday, I could attend only half of your session because 7:30, 7 to 8, you had 6:30 to 7:30. 7 to 8, I have a pranayam and meditation class every
Certainly.
Sunday
That's why
and
we are looking
Wednesday.
at recording the session. However, most of the
Ah,
sessions are planned keeping two things in mind: experts availability,
yeah,
because
definitely.
everyone is doing out of voluntary basis, no one is being
Yeah,
paid. And the second is how many participants can join in, especially senior
mm,
citizens. So
yeah.
keeping you informed, we will be sharing the flyers and messages at the earliest so that you can circulate it amongst your loved ones. And please do join in and enrich yourself with such power-packed and right information. In the world, there's a lot of gimmicks happening. And we, as WICCI Equitable Parenting Council, are focusing to provide the right information without any salesy or marketing gimmick, right?
Thank
And so it's simple, it's clear, it's to the point, and only experts come on the platform to share their expertise. So thank you so much, everyone, for joining in. And God bless each one of you all. Keep you all in the best of health, and hope you all take in this information with to your loved ones and uh, take care of them as well. Yeah. So with this, handing over back to Sujata.
Thank you. Thank you, Aziel. All right. So thank you, all of you. Take care of yourself and then see you in the next session. Thank you, Dr. Savana, once
Thank
again.
you all.
Thanks,
Thank you for having me
Aziel.
here. Thank you.
Bye, everyone.
Bye.